distinguished Senator Hope Uzodimma and the Carter Center, about 10.2 million tablets of ivermectin and 3.8 million tablets of albendazole were distributed to eligible persons free of charge. 3,836,410 persons in Imo State were treated of onchocerciasis and lymphatic filariasis out of estimated 4 million targeted for treatment, while 1,117,875 school children were treated for soil-transmitted helminths out of estimated 1,491,643 targeted for treatment. The impact of our treatment was measured through transmission assessment surveys by the Federal Ministry of Health. Onchocerciasis crude prevalence rate was 14% in 1995, has now reduced to less than 1% across the endemic local government areas, while lymphatic filariasis, which prevalence rate was 15% in 2010, has now reduced to less than 2% across the endemic local government areas. Elimination of these diseases in our community requires integrated effort. As we join the rest of the states in the Federation to mark World Neglected Tropical Diseases Day in Imo State, we use this medium to call on all the community members, NGOs, civil society organizations, and the general public to act now, act together, invest in neglected tropical diseases by supporting the annual distribution of ivermectin, praziquantel, and albendazole in our various communities and schools, and by encouraging our people to ensure they swallow the NTD drugs, the ivermectin, albendazole, praziquantel, and mebendazole during mass distribution of medicines, to keep their environments clean, to provide clean latrines at homes, avoid contact with contaminated water, wash their fruits and vegetables before eating, stop open defecation and urination, always wear protective covers while farming, always sleep under insecticide-treated nets, and visit the nearest health facility when symptoms are observed. The Imo State government, in its commitment to ensuring good health to the people, will continue to give support towards elimination of neglected tropical diseases. Neglected tropical diseases can be treated, prevented, and eliminated. On behalf of His Excellency the Governor, distinguished Senator Hope Uzodimma, I call on all of us to act now, act together, and invest in NTDs for the good of all. Thank you. The most vulnerable people are the poorest, the people without easy access to potable water, people living in very dirty environments, and people who cannot actually know if they have to go to the hospital or not at the points they need to. Those are the people most affected. The sex distribution is not very particular. It can be men, it can be female. So those are the people that can be affected, the very vulnerable people.
Now, what about the climate change?
It has always been there, even before the whole ozone layer depletion and everything. So it's not something to be tied to climate change.
So in the absence of every other thing, no commission, I think we have come to the end of this particular briefing on NTDs.
I think we have not come to the end. IBC.
No, I mean that of NTDs.
Yeah, so let's continue. I think it's still the same thing. So quickly, we can just go ahead so that we can just take it.
Recently, His Excellency flagged up free medical treatments for Imo people. We want to get your input. Is it still on? What's your impression? And then the statistics of the treated and those in the process of getting treatment.
Thank you very much. On the 30th of January 2023, His Excellency the distinguished Senator Hope Uzodimma flagged off the free medical mission for indigent Imolites those who could not actually afford to go get treated on their own because of cost of out-of-pocket expenditure. And that's why I'm tying it down to the same neglected tropical diseases. It can't just be just this neglected tropical disease mentioned. When we look at health, we look at health as in total. Your environment, your social well-being, your mental and physical well-being, not just the absence of infirmities. So that's necessitated the fact that a mission had to come into Imo State, and we partnered with our brothers and sisters who came from the states under the umbrella of the Association of Nigerian Physicians in America. This mission was done to assist most people. Statistically, we saw over 2,289 persons by physicians. When we mean physicians, we mean the internists, general physicians, the medical part, the pediatrics, and then we had over 400 surgeries done. Now, in the 400 surgeries, we did about 100 myomectomies, that's fibroid surgeries. We did about 200 intraocular and extraocular surgeries, that is cataract surgeries, pterygium. We did over 100 hemiography and about 80 hyniotomy, that's hernia repair in both adults and in children. And we had over 50 lumps and bumps excisions. So it's the effect of this medical mission is reverberating, because even people who were on the operating table, most of them were done under spinal anesthesia, so they were awake, they were sure of what was going on, and they kept praying for the success of this government, and telling us that they couldn't have afforded this treatment, but this opportunity has been given to them. Now, the medical mission ended officially on the 4th of February, but we spilled over to the 6th of February, and kudos must be given to our doctors in Nigeria, who were 90% of the volunteers of this mission. I must proudly say that during this mission, we had just one surgeon that was amongst those from America. The rest were our doctors from Nigeria, and we did extremely very well. During this mission, we had an opportunity of cross-pollinating ideas with those that came from America and those of us here. They learned from us and we learned from them. And we are very happy to say that all hands were on deck to make sure that everything went well. So as I thank His Excellency the Governor for being the financial support and the bankroller of this whole mission, we also want to extend our thanks to those who have volunteered their expertise to work. Most especially, I want us to say a big thank you to the Nigerian Medical Association. We want to say a big thank you to the Pharmaceutical Society of Nigeria. We want to say a big thank you to the Association of Medical Labs and Scientists of Nigeria, all of them, and the National Association of Nurses and Midwives in Nigeria, who all came out in their droves to make sure that this actually went all well. So it's a very big thing for us in Nigeria. It has shown that we have capacity to do a whole lot, and we look at sustainability of the mission, because it shouldn't be a one-stop thing. I also want us to know that His Excellency did not do this just because he wanted to do this for political gains. He did this because of his love for Imolites. And every Imo son and daughter who contributed from their hearts, and no one penny was paid to anybody. They did this pro bono in making sure that we give back to the society what we as doctors, what we as nurses, what we as pharmacists have gotten from the society. So we are very, very glad that this has come. The statistics I have given you, for now, we have ended the first medical mission. We hope to plan another medical mission soon. I don't know when, but we hope to plan more medical missions to help our people. I also need you to know that during this mission, we had about 11 people that were on dialysis, and we had to do a fistula creation for them to enable them have their dialysis done easily. So we thank those friends that came, because there was a vascular surgeon who came and he created AV fistula for all the dialysis patients, and now it's easier for them to get their dialysis. Also, during this mission, we encountered some children, little babies, one 4 months, one 5 months, who had a hole in their heart. His Excellency has also undertaken to pay for the cardiac surgery, and the cardiac surgeon is coming from the United Kingdom to do this open heart surgery for these children. And we hope that at the end of the day, these little children who are 4 or 5 months, who don't know and have anything for now to give back, will grow up knowing that the government did this to keep them alive and give back positively to the government. We thank the states for this. We thank the Imo State Specialist Hospital for the platform we used, being their hospital. We thank the management of the Federal University Teaching Hospital of Were for also their platform that we used. We also thank the management of Baden Specialist Hospital and Regions Hospital for their private hospitals that we also use to do our surgeries. Now, most people will say, in those days of the COVID, oh, we have an isolation center. Today, we have, that place has actually served as a place where we were able to admit our surgical patients, and our nurses proved to be wonderful managers of post-op patients while they were at the Woody Center. So I doff my hat for them, and I thank His Excellency for making sure that we have such an edifice as that Woody Isolation Center, which has actually helped us today. So for you, the press people, who were also there from when we started till now, we also thank you, because the publicity we've gotten about this wouldn't have been possible without you. So we thank everybody that have been part of it, and we look forward to giving Imo State the very best that we can give to Imo State. For us, it is just one thing: for improvement of the health indices of Imolites, and that is why we are here to do what we're doing. So thank you very much. God bless you.